Okay, so we're quickly looking at the next respiratory issue. This is what is known as the ARDS. Okay, this is what is known as the ARDS. So this is what is known as Acute Respiratory Distress Syndrome. Alright, so you just have to do it. In a normal human being, you should have your empty alveolar sacs, alright, where air is usually filling up. Then, alright, and a human being that is affected by this, you have like a fluid-filled alveolar sac, you understand? So that's a severe, it's a life-threatening condition, right? So the lungs are becoming inflamed, filled with fluid, so it's making it very difficult for you to be able to like breathe, alright, properly. So there's little oxygen passing into the bloodstream. Typically affects people who are already critically ill or people who have suffered some major trauma and all that. So what actually triggers this acute respiratory distress syndrome? So it can be caused by both direct and indirect lung injuries. Sepsis, most common cause, severe pneumonia, COVID-19, aspiration of stomach contents, trauma, inhalation of smoke, toxic chemicals, pancreatitis, all those blood transfusions, or you are near a drowning state. So what happens to the lungs? Of course, the alveolar-capillary barrier is damaged. Alright, so fluid leaks into the alveolar sac, causing some non-cardiogenic pulmonary edema. So this leads to you having a stiff lungs, poor oxygen gas. Okay, that's poor gas exchange, severe hypoxemia. So having low levels of blood oxygen. Okay, so diagnostic criteria is the Berlin definition, where you are trying to look at the severity of what you are dealing with. So the condition can be mild, can be moderate, can be severe. Then symptoms must appear within 1 week of a known insult, alright, and must not be due to heart failure. That's why they call it non-cardiogenic pulmonary edema. Alright, so symptoms: you have rapid shallow breathing, severe shortness of breath, cyanosis, that's a bluish skin, confusion or fatigue, right, low oxygen levels despite oxygen therapy. So what we got on the treatment strategy is mechanical ventilation, because like a bulk of it, the patient is actually having like they're finding it difficult to like breathe, you know. Prone position to improve oxygenation, fluid management and sedation. Alright, treating the underlying cause. Right, you have an infection, use antibiotics. Then severe cases, extracorporeal membrane oxygenation may be used. Complications could actually lead to pulmonary fibrosis. This is when the cells, you know, of the lungs eventually die off. Ventilator associated pneumonia, blood clots or collapsed lungs, long-term cognitive and physical impairment, and all of that.